When you hear teeth cleaning, what comes to your mind? Brushing or flossing your teeth against plaque or calculus, which causes gum diseases and tooth decay, at the right time and with the right kind of brush. But what about cleaning your teeth at the dentist? Hello once again. Welcome to today's episode. Today, we would be talking about teeth cleaning at the dentist, why it is important you do, how it should be done, and when it should be done. And I hope you have subscribed to this channel and liked this video. If not, you still can do that now. Just brush the like and follow button with your fingers or brush if you have one. And watch till the end. I may have a surprise for you. Teeth cleaning at the dentist. Many people don't go to the dentist because of inherent phobias and anxiety, and that is very normal. Not everyone loves the dentist. True, but staying away from the dentist is risky. For this discussion, let's break teeth cleaning at the dentist into 3 sections. Number 1, when you go for teeth cleaning at the dentist. Number 2, why you need to have your teeth cleaned by a dentist. Number 3, how teeth cleaning at the dentist works. On the win. We know not everyone loves the dentist, but everyone should visit at least once the dentist once a year. And there's a debate as to how regular one should visit a dentist. Honestly, it depends on the oral and overall health of an individual, as every patient is unique and has a different lifestyle. It's advised that healthy people visit the dentist once a year or once in 6 months. Otherwise, you should visit the dentist to have your teeth cleaned at intervals of 3 months. But you should also know that visiting the dentist regularly helps avoid filling and removing teeth and prevents future complex and dental treatment. About the why. Why do I need my teeth cleaned at the dentist even if I can clean mine at home? There are 4 reasons why. Number 1, early detection of problems. Number 2, prevention of gum diseases and cavities. Number 3, prevention of unhealthy mouth odor. Number 4, promotion of overall and oral health. Bacteria are tiny organisms that live inside us. Some are useful, but some are not. In the mouth, there are bacteria which live on the teeth and feed on the food particles left in our mouth after a meal. The more they eat, the more they grow, till they form a buildup of films of bacteria on the surface of teeth called plaques. When these soft buildups get hardened, they are called calculus. When the plaques or calculus are much, they may lead to gum diseases or cavities. These are holes in the teeth. Teeth cleaning at the dentist helps to reduce the chances of this happening by reducing plaques and calculus. And when the teeth are clean and void of any diseases, the mouth wouldn't have any odor. An odorless mouth is a healthy mouth. How is it done? Many people consider teeth cleaning scary and difficult because either they feel pain during the session or they get their information from hearsay. Whatever the case, teeth cleaning shouldn't be painful. At the most, minimal pain or slight discomfort. There are some reasons why most people feel that way. That's because they have dental sensitivity. They have stayed away from the dentist for a long time, and that they may have a temporomandibular disorder. There are several processes in the teeth cleaning procedure. Each of the processes is important as they play important roles, and knowing teeth cleaning works helps to make the discomfort a bit endurable. Teeth and gum examination. This is the first step in teeth cleaning, and also a very vital one. It helps the dentist to check for signs of existing dental problems like inflamed gums, tartar, and plaques buildup. This step also makes it possible for the dentist to know what to do next. Scaling. This step is achieved using a scaler, which is a small tool that has a hook. The scaler is used to remove plaques and tartar. There are 2 methods for getting this done. The manual method, which feels like scraping and used for smaller particles, and the ultrasound method, which uses vibrations and water to dislodge large particles. Polishing and flossing. To some dentists, this is the last stage, and to others, it's the second to the last step. The polishing is done by the use of an electric device and a prophylaxis paste. The polish helps to brighten the teeth and remove stains and dark spots. It is not as uncomfortable as most people believe, but it causes a slow grinding motion of the teeth. Polishing can be done multiple times depending on the dentist, and after that is flossing, which helps remove the particles and paste left after polishing. Fluoride stage. This is not common with most dentists, but it is an effective method of teeth cleaning. The fluoride is placed inside a mouthpiece and left in the mouth for about a minute or so. One good thing is that the fluoride comes with several flavors. Have you or a loved one experienced teeth cleaning at a dentist before? Tell us your experience and treatment used in the comment section. It will encourage others. Now, as you might realize, these steps take quite a bit of time and effort. And I understand that these steps may seem pretty painful or difficult, right? That is why I've put together a free practical guide for healthy teeth to make this easier for you. With this, you will never have to worry about teeth cleaning ever again because it will teach you exactly how to keep your teeth healthy. So click the link in the description now to get your free download. And if you want more videos on how to max your oral hygiene, make sure you subscribe so you don't miss out on future videos.